I'm Dr. Jay Bernstein, the Chief of the Emergency Department here at Northside Regional Medical Center. We have an emergency department that's fully functional 24 hours a day, 7 days a week. We have 21 fully private rooms.
And patients and families really seem to enjoy the privacy that can afford you when you come in to be seen. My name is Cindy Bagus. I'm the ED Assistant Director here at Northside Regional Medical Center's Emergency Department. We are a certified chest pain center. We strive to have you seen by an emergency physician within 20 minutes, and consistently our average has been less than 20 minutes for that wait.
Hi, I'm Jeannie Molichak, a registered nurse here at Northside Regional Medical Center.
I'm Rosemary. I'm a nurse here at Northside Regional Medical Center.
Welcome to Same Day Care. We are a 21-bed private unit with various services.
We provide outpatient surgery, blood transfusions. We also do procedures for interventional radiology, all on an outpatient basis. And also we provide pre-admission testing.
My name is Lori Campana, and I'm a registered nurse at Northside Regional Medical Center. I've been in endoscopy for almost 20 full years. In endoscopy, we do numerous procedures. We do upper scopes or EGDs. We do colonoscopies. We also do bronchoscopies. And then we have several specialized procedures that we also do for select clientele. We have 3 endoscopy suites, and all the suites are private. Our recovery room holds 6 patients, but they are very wide areas, and there are curtains in between each bed, so everybody is in a private space.
Hello, I'm Seth Kuick. I'm one of the new hip and knee joint reconstruction guys at Youngstown Orthopedics. So the biggest advantage of using the Mako robot, it's a tool. It allows you to place your components where you intended to place them. The biggest issue with a traditional joint is that we're not perfect, so our cuts may be off, and while we do excellent surgeries and produce great joints, this provides an extra level of precision that was previously not available. The Mako produces a very predictable, reliable joint replacement, and when I leave the operating room, I'm confident knowing my implants are where I intended to place them. Mako robots tend to reside in larger cities, universities. One of the biggest benefits is we have this technology in Youngstown, Ohio at Northside Regional Medical Center. And this allows patients in this area the chance to experience this technology without driving 60, 70, 80 miles to the closest center that has one.
My name is Paul Rich. I am the Chief Medical Officer at Northside Regional Medical Center. So we offer a full line of women's services at Northside. We provide labor and delivery services. Prenatal care within our primary care clinics is offered here on the premises. So we take care of women throughout the course of the entire pregnancy and then offer delivery services to them as well.
My name is Matt Ozanich. I'm the Director of Pre-Hospital Care for Northside Regional Medical Center as well as Trumbull Regional Medical Center. We have some community-based initiatives that we're working on where EMS can actually activate in-hospital protocols. It's very evidence-based medicine, shows that anytime EMS is going to bring in a patient, recognizes certain signs and symptoms, calls it in, and we activate in-hospital protocols based on it. The patient outcomes are better, patients get treatment sooner, things like that. So some of the initiatives we have at Northside are door to CT for stroke. So if EMS calls in and says we're coming in with a stroke patient, they go straight back to the CT scanner after being briefly seen by the emergency physician. Another initiative that we have is door to cath lab, where if EMS is bringing in a heart attack that meets certain criteria, they actually go straight to the catheterization lab and they get the intervention from the cardiologist right away. Time is very important. Time is tissue. We really try to push that in a lot of the major medical fields now. Time is tissue, so we want to make sure that we get those interventions done right away.
My name is Ralph Taylor. I'm the Chief Nursing Officer at Northside Regional Medical Center. The thing that we want to drive at Northside Regional is making sure that everyone has the best experience possible when it comes to hospitalization.
My name is Matt Ozanich. I'm the Director of Pre-Hospital Care for Trumbull Regional Medical Center. We have a 29-bed emergency department equipped with 2 trauma bays. We are a level 3 trauma center. We also have 3 cardiac rooms. We are a cardiac center as well as a resuscitation center, and we can do emergency catheterization in the event if somebody's having a heart attack. We also have a few community initiatives where EMS, bringing a patient to us, can actually activate in-hospital protocols. So if somebody's coming in with a stroke, EMS can call in a stroke alert. They can go straight to the CT scanner and bypass the emergency department. If EMS is coming in with a heart attack, they can call in and say, we're coming in with a STEMI patient. We can actually get the cardiologist activated based on the EMS recognition. So just trying to improve times and improve patient care.
Hi, I'm Casey Awesome, a vascular surgeon here at Trumbull. We're in the cath lab where I do my minimally invasive procedures. Typically a patient can come in if they're having claudication, which is leg pain, or even gangrene or rest pain. We'll work them up in the office, do non-invasive studies. If we think that there may be a blockage that we can intervene, we'll bring them here and we can take pictures of the vessels. In the same setting, if there's a blockage, we can try to get a balloon, and sometimes we'll stent, and typically the patient will go home the same day.
I'm Dr. Larry Woods. I am an interventional cardiologist and cardiac intensivist at Trumbull Regional Medical Center. We take care of chest pains that come in 24/7. We have a 24/7 catheterization laboratory where we take heart attacks, put stents in emergently. There's a whole crew of cath lab as well as cardiologists.
My name is Meeta Raheja. I'm an electrophysiologist, which is a subspecialty of cardiology. At Trumbull Regional, we are equipped to handle all electrophysiological procedures or problems, including treatment of atrial fibrillation, ventricular tachycardia, and taking care of defibrillators. I work hand in hand with the interventional cardiologist and the general cardiologist at Trumbull Regional Medical Center.
My name is Shelley Lamb, and I am the operations manager for medical imaging for all of Steward Healthcare and around the Valley hospitals. Here at Trumbull, we offer a full line of imaging, including CAT scan, MRI, nuclear medicine, a mammography, regular x-ray. We do have 2 interventional radiologists here, so we do a lot of hip injections, paracentesis, thoracentesis, CT biopsies, ultrasound guided biopsies. We do a lot of breast localization. We place clips.
Hi, I'm Steve Varconi. I'm the program director here at Trumbull Regional Medical Center's Wound Care and Hyperbaric Center. As you can see behind us, we have one of our hyperbaric chambers. Patients can go in the chambers, and the oxygen really helps get into the bloodstream to heal that wound from the inside out. So you're getting wound care on the outside from the clinic, but then getting treatment from the inside out. You do not need a physician to be referred to the wound care center. With the wound care that we provide in the center, there's a bunch of metrics that we can meet, and by meeting those metrics have awarded us Center of Distinction and Center of Excellence since 2015. So it's something that we take a lot of pride in down here, and that comes from the fantastic network of physicians we have along with the nurses.
I was at my office and I just started to feel funny.
I was walking down the hall. He was coming in. He was grasping his chest.
It was like any other day at the fire station. We were here and the call went off.
My name is Jim Franks and I'm a practicing attorney here in Trumbull County. Back on, it was the 17th of November, I was at my office up the road in Cortland, preparing to take some things to downtown Warren to file. And it was kind of funny because I had not had what I would call symptoms ahead of time, but I was at my office. My hands started to ache, and I didn't think anything of it until I broke into this cold sweat. And I knew from watching TV ads and so on and so forth that a sign of a heart attack was breaking into a cold sweat. First thing I did is I got on the phone, and my wife answers the phone, and she's like, "What's up?" And I said, "You know, I think I'm having a heart attack, but I'm going to drive down to Bob's, which is Dr. Naples' office. That's what I do. I stumble out of my office, get in my car, and drive down to Bob's office. You know, one of the nurses, as I walked in, said, you know, can we help you? And I said, yeah, is Bob here? And she goes, well, yeah, can we help you with something? And I said, yeah, I think I'm having a heart attack. And she says, well, come with me. So she walks me down the aisle, and actually as I'm walking down the aisle, Bob's coming up the aisle, and she goes to put me in one of the examination rooms, and no sooner do I get to that room, I go down.
So he's having this chest pain, and it's a very significant amount. One of my nurses was doing the EKG, another one was taking the vitals, blood pressure and heart rate. Someone else was calling 911.
The call was approximately 10 in the morning, and just receiving the call, you're obviously on heightened alert.
And we responded to Dr. Naples' office in Bezetta. When we got there, the patient was in one of the rooms, and as we walked in, we could tell that something was wrong. His color just wasn't very good at all, and he was very anxious and appeared to be in some distress.
So we get him somewhat stabilized. Paramedics are here. I made a phone call to Dr. Nador, the cardiologist. He got the cath lab ready.
On the way to Trumbull, we started 2 IVs on the way in and got into the emergency department, met with the cath lab staff, and then took the patient straight to the cath lab. When you're dealing with the heart, time is tissue. From the time that we left our station here until the time that we pulled into the emergency department in Trumbull was 20 minutes.
That artery that was 100% blocked is 100% open now, and he's a very lucky individual.
All the dominoes just fell into place. If one thing is different, I'm not here. You can forget about the physical aspect of it. It was the emotional aspect of knowing you have survived and you have a life afterwards.
Hi, my name is Krista McFadden, and I am the president of Hillside Rehabilitation Hospital. We are a 69-bed facility dedicated to rehabilitation in the Mahoning Valley for over 50 years. Our patients come to us in a highly compromised situations involving strokes, brain injuries, orthopedic injuries, motor vehicle accidents, neurological impairments, and we're able to take them to a higher level in a very short period of time and transition them back to home or wherever their next level of care may be. Our outcomes are superior, often delivering care better than the region, and our satisfaction rates exceed the 90th threshold.
I'm Jeffrey Kuntz, Director of Rehab Services here at Hillside Rehabilitation Hospital. We offer a comprehensive program that includes 3 hours of therapy daily. 2 hours is usually physical therapy, 1 hour is occupational therapy. We also have speech therapy in addition to that. Our patients who also need some reintegration back into their recreational activities, we offer recreation therapy as well, so that we can get them back into golfing, into any kind of activities they like to do. We do have an outdoor sports complex that has bocce, basketball, archery. We have air rifles. We also have areas where patients can replicate their home functions. So we have 2 kitchens down here in Rehab Hall where patients can get back into cooking, cleaning, doing laundry. We also offer outpatient services. We offer outpatient physical therapy, occupational therapy, speech therapy, from pediatrics through adults.
I'm David Trimble. I'm a vocational rehab program manager. I work at Hillside Rehab Hospital. We provide services to individuals with disabilities ranging from cognitive, physical or emotional disabilities that create barriers to employment. What we do is work with them in getting them ready for a return to community-based employment. We do this through cognitive testing, educational testing, through situational work adjustment programming, which would involve placing them in employment environments to get them reacclimated to a structured work environment. I think that we're a unique program only for the reason that we're able to take folks from the start and see them all the way through to the employment part of work, which means we test, evaluate them, we identify their strengths and limitations, we build on the strengths, we build on the limitations to get them competitive, and then we see them all the way to the end where we actually help them secure employment.
The work we do here is precious. Our patients come to us in a highly debilitated and compromised state. We're able to transition them to the next level of care, highly satisfied and in a much better state than when they arrive to us.
Welcome to the Comprehensive Center for Joint Replacement at Trumbull Memorial Hospital. This program is created to change the way patients and their families think about and experience hip and knee replacement surgery. Structured around the fundamental principles of wellness, the program is patient-centered and aimed at giving you the knowledge and tools to make the transition from hospital to home as smooth as possible. From our pre-testing staff, who will screen and prepare you for surgery, to our physical therapy staff, who will teach you mobility and exercises, we believe in consistency. Before surgery, you will attend a pre-op class where you'll receive information on what to expect before, during, and after your joint replacement. You are encouraged to have a friend or a family member act as a coach as you go through the joint replacement process, beginning with a pre-op class and continuing through the recovery process. Our joint care coordinator will work with you and your doctor to coordinate your entire care experience and answer all of your questions. We are determined to make your joint replacement experience as comfortable as possible. Our amenities include an informative pre-op class for patients and family, a patient guidebook with surgery preparation and aftercare tips, all private suites. You get to wear your own clothes, no hospital gowns for our patients, unlimited visiting hours with your coach, daily walks on our Around the World tour, group therapy twice a day, daily newsletters, educational flip charts answering patients' most frequently asked questions, educational classes for you and your coach, a reunion celebration approximately 12 weeks after surgery. Right outside of your hospital room is our walking circuit. Experience shows the sooner our joint replacement patients start walking after surgery, the greater mobility and success they'll enjoy when they leave. Every 50 feet you walk, you'll reach a new travel destination and level of independence. The group therapy room is also located on our floor, just a few feet away from your room. Twice a day, you'll be escorted here where you will join other patients. Together, you'll learn how to use your new joint, improve muscle strength, flexibility, and range of motion. A joint care experience you're not likely to forget. Group therapy will give you and the group encouragement you need to get your body and your life back on track again.
Pain control is a very important part of our program. We use an innovative triple approach to pain control that keeps pain at a minimum, so you're able to get up and walking approximately 2 to 3 hours after your surgery.
The first 3 surgeries at other hospitals were horrible. I woke up after surgery. I was heavily medicated. Pain on a scale of 1 to 10 was probably 1,000. And I came here, had surgery, woke up after surgery. I wasn't overly medicated and I was in no pain.
From the day you decide to have surgery at the Center for Joint Replacement at Trumbull Memorial Hospital until the day you head home, our staff will provide you with everything you need to help you get back to a better quality of life. We're a national award-winning program. We're the first program in Ohio to achieve advanced certification for hip and knee replacement from the Joint Commission. We're also the first destination center of superior performance for joint replacement in Ohio, and we're a center of Blue Distinction Plus from Blue Cross Blue Shield. We believe the key to better outcomes is a commitment to provide you with a thorough understanding and knowledge of what to expect during your surgical experience. Knowing what to expect goes a long way to reducing stress and anxiety and preparing you for as smooth a recovery as possible.
The Center for Joint Replacement not only got me back on my feet quickly, but I got my life back, the life that I had enjoyed before, and I continue to do so.
We know you have a choice of where to go for your procedure. Our goal is to ensure your stay with us is as pleasant and comfortable as possible.